Dr. Crosby, are you on live with us? Waiting for Dr. Lauren Crosby. Paging Dr. Ah, we have you.
Hi.
Hey, how are you
Heidi.
doing?
I'm good. How are
Thank you.
you?
Thank you for being here today. First of all, big hugs to you, virtual. And full disclosure, you are one of my favorite pediatricians in the world. And not only because you're the pediatrician to one of my favorite kids in the world. Since the day he was born, Lennox, 7 years ago, more than 7 years ago, time flies. So thank you for being here. You see babies every day, which makes me very jealous of your job, by the way. I see babies in other circumstances for some, but for the last, I don't know, month, I haven't seen any at all, and I really miss them. So you see them in the hospital, you see them in your office, and these days you're seeing a lot of worried parents, I would say. You always see a certain number of worried parents. Every parent worries.
It's normal.
Right? Especially those first timers, especially Emma. Not naming names. And so you're also speaking to them on the phone, and you're speaking to them via video with telemedicine.
We are.
And just in case you haven't gotten enough questions lately, we're going to ask you some from our mom community. What to expect mom community. And I know we just have you for a half an hour, so I'm going to dig right in.
Okay, good.
The first question we have is, what are coronavirus symptoms in a baby, in a child, and are they different from symptoms in an adult?
Such a good question. You know, this is evolving every day. It's still so good that we're finding things out every day. I mean, what we do know is that, thank goodness, in children, overall, the illness is mild. So we're not testing everybody, so there may be those walking around here who carry it. So overall, in kids, they may have a cold. They may have full symptoms of fever and respiratory symptoms, coughing, could flare up asthma, so fever and the typical things you hear for adult are possible. So the fever and the dry cough and the chills and very flu-like, but they may have a cold and be running around happy as a clam, or they may have no symptoms at all and just be carrying it, which is also a big concern. But we're also finding that it may be the same in adults too, that they may be carrying it and not be sick or have any symptoms. So that's being looked into more by the CDC when they start to make more recommendations about who should wear masks and when. But children, at least most children handle this very well and do great with it. So thank goodness.
Thank goodness for that. So how do you, and in fact, are the symptoms usually more mild than they are for seasonal flu? Of course, flu season is wrapping up, but around the country, not necessarily completely gone. And kids get all kinds of viruses. The viruses we call about saying, my kid's running a high fever, and you're like, it's going to be fine. And the parent's like, but it's a high fever. So how do you differentiate necessarily between COVID symptoms and flu symptoms or other viral symptoms?
So
hard.
They're pretty much the same. And so you can't necessarily differentiate. And it's true right now, flu has gone down, the incidence, and also people aren't around each other. So in general, we're not seeing all of the illness that we typically see, and we're not getting the phone calls about all the other colds and symptoms we typically see. But what we do tell everyone right now is, if you're sick, assume it's coronavirus and quarantine and stay away from everybody. So just assume that that's what you have, because you can't really differentiate. That's the problem.
That's true. And everyone should be staying away from other people, other kids especially. Even I'm staying away from kids, and
I was going to say,
so unlike
parents, it's so important, because the thing about them is, though they don't make up the highest proportion of the population, they do make up the highest proportion of people who are at risk and have a higher incidence of critical problems. ICU death is highest in the older population.
Not that we're calling
65 and up for sure.
Yeah.
But the other thing that people have to keep in mind, and this is where the pregnant women and the younger moms fit, is they are a larger proportion of the population are the people under 50. About 50% of cases, and again, still there isn't a ton of testing, if this may change, are in the people who are in the pregnant age group. So,
exactly.
You know, we have to be careful. Even wearing gloves can sometimes keep you from touching your face because it makes you think about it. So for markets, I would wear a mask and I would glove, and you want to be as careful as possible. I would try to not take children out to markets or any place where there's public. You know, you don't want to do that.
Yes.
No visitors. That's what the whole social distancing is. I mean, there are people who weren't taking it as seriously. There was a big farmers market here in a nice area on the weekend. So our mayor was like, we're shutting you down, people. They were all crowded. If they want to be able to resume activities sooner, then people need to social distance now so that this virus can't find new homes all the time, you know?
No, that's true.
It's so contagious, more contagious than the flu. It's not the flu, it's worse.
No,
you know,
for sure. The symptoms may not be worse,
right,
in certain populations, but at the same time, the result could be worse for our general population.
Absolutely.
And we want to avoid that.
So
if you absolutely have to leave the house with your baby, and you know you have no one to leave your baby with, so I always say it's best to baby wear, because babies are protected that way. How do you feel about that? You agree?
I 100% would do that if it was me and I had my little one. If they were that small now, I would wear them. I would even cover with like a receiving blanket or make a bibby thing to go over, just as an extra layer of protection too. And then I would mask up, you know.
And you know,
I always wear your hair up and wear a hat so that you know nothing can even get on your hair. Just like change clothes when you get home. All of those things, just an extra precaution. I mean, I do that. I'm wearing scrubs at the office. I change before I come home. I don't get in elevators with other people if you can avoid that too, and not touch doorknobs and stair rails and everything.
Yeah, absolutely. And I usually say wear your baby front facing, because they like to see the world. Not now.
Right, I agree.
Now wear them facing and protect them. And it's hard to wear a 7-year-old, so we're not going to take them out of the house to stores if at all possible. And it's hard also to keep a toddler from putting everything in their mouths, touching everything, putting them in their mouths. Even if they're in a stroller going down an aisle, they are resourceful, and they will reach for something and touch it before you can intercept, put their hands in their mouths. So we've got to be super careful.
It's true.
Absolutely. The next question that I have from the moms is there any way to boost your immune system or your baby's immune system during this? And it's not just preventing cold now.
A lot of stuff about
COVID-19
that isn't necessarily true. Oh, can you hear me? Okay. Froze for a sec. We got it back. Okay, good. So the best things for the immune system: sleep, sleep, sleep for everybody. That's the best thing. Nutritious diet, lots of fruits and vegetables, staying hydrated, getting fresh air, but staying your distance from people. But getting out, it's good for your mental health and it's good for you physically.
Absolutely.
Having some kind of calming, positive thing you do every day, your own little me time, meditation, even if it's 10 minutes, it's good for your mind. That also boosts your immune system. All these supplements, there are some people that are really trying to take advantage, some companies, of this and try and do sales because you need this and this and this and this, and they really aren't proven to do anything for this. I mean, yes, there are there's studies going on about using high dose vitamin C IV. I think for the news on that last week in New York in one of the ICUs, but it's not proven yet. And though, at least if you take extra C, if your kidneys are normal and you're regularly healthy, you'll just pee out the extra, so it's not harmful if you want to take a little extra vitamin C. But all those extra supplements, I don't recommend taking tons of elderberry or any of those things.
Exactly. And the other thing to keep in mind is that some supplements can be harmful or potentially harmful. They can be, you know, if they're medicinal herbs, then they have a powerful effect potentially, and especially in pregnancy, breastfeeding. So you should always check with your doctor, your pediatrician, your OB before you take anything when you're pregnant, besides a Tylenol. So another case of buyer beware, especially in the supplement aisle. And getting vitamin C from fresh fruits and vegetables is probably the best way to do it. And by the way, kids who don't like their vegetables, we know you can get lots of vitamin C from their favorite fruits, like mangoes. So
berries and
berries, lots of berries.
Little cuties and however, but
cuties,
that's why it's good to try and do it.
A cutie.
Or a smoothie. You know, throw everything in your smoothie with your handful of baby spinach, you know. Exactly. They won't know it's there. You know? Baby
spinach, especially. So what about those well baby visits and scheduled vaccines? Because the first thing I worry about when I hear that there's, you know, people aren't going to the doctor as often is, will they be able to stay on an immunization schedule? And also, you know, you have questions when you have a new baby and you want to make sure those questions are answered. Maybe you want to weight check because you're afraid your baby's not gaining enough weight, which they usually are. So what do you say about that?
So we are bringing in kids age 2 years and under into the office. You know, different offices are doing it differently, but a lot of them are keeping sick people out. So we're actually not doing any sick visits in the office. We're also screening everyone by phone before they come in so that there's nobody sick. If it's a newborn, we're allowing both parent and partner, you know, mother and partner. We're allowed a support person with them. Up until even at the 2 month, because often it's the first baby's first set of vaccines. They want to have some extra support for that. And then we're saying one parent only or one caregiver and no siblings after 2 months. But we're taking temperatures of everyone. We're gowned and gloved and masked at the office, and we're changing and cleaning constantly. So we don't want those little ones to be open and vulnerable to other diseases that we can prevent. This one we can't prevent. So we're trying to keep the vaccines up to date. Same with like jaundice tests for babies. We're having them come in first thing in the morning early, get them in, do our blood test, get them out, call with results. We're doing all the telemedicine visits and even checkups now for older kids. We're going to do virtually. And then when this calms down, we'll have them actually come in. But even the teenagers, I mean, there's different issues at every age, whether it's anxiety and depression. Anxiety in a teenager is very different from anxiety in a 3-year-old. So we can talk about that and recommend maybe a book that would be good to read with them or about for them. So we're still trying to do it.
That's such an important conversation to have, by the way. And pediatricians screen for postpartum depression, postpartum mood disorders, just as OBs do, but you see them more often, and you're going to be seeing them on telemedicine potentially. So it's really important that you're in the front line, not diagnosing, but noticing symptoms of postpartum mood disorders in moms.
We have a handout for them at the 2-week check. There's a questionnaire, and then we review all of it too.
So is it okay to breastfeed if you get the virus or you think you have the virus, or you find out, you know, you go to the hospital to deliver and you're tested and you test positive for the virus? What about breastfeeding?
So they don't know 100% yet. Right now, you are allowed to breastfeed. We are allowing it because we're thinking of our past experience with other viruses, and we let moms breastfeed when they have the flu. And the other kind of more normal coronaviruses that cause colds that we always see during cold and flu season, we let moms breastfeed. So we think that it's probably okay, and maybe the baby will get some antibodies to it if the mom has had it or has it.
That's true.
So far we are thinking that it is okay.
And you would probably just practice the same hygiene that you should anyway. Wash your hands before you feed. Wash your hands before you do anything for that matter, and after you do certain things too. But also, would you recommend wearing a mask when you breastfeed?
Yes, I would definitely wear a mask if you're sick. Any kind of illness right now. And in general with a newborn, I always am like, if the mom is sick and nursing, it's better to mask. So I would now especially, a mask for sure. Hand wash before and after.
And in terms of, you're not here to necessarily talk about pregnant women, but is it okay for pregnant women or parents to work in a healthcare setting right now and then go back and be with their families?
That is, different hospitals have different regulations about that right now. A little controversial, I think, at some places.
Yeah.
So I think that they are trying to keep people working who want to work, but I don't know if that anxiety level, I think some places allow you to not at least work in those areas where you may be more at risk. So they may move you to a different part of a facility so that you're less exposed potentially, but still you're going to use all the universal precautions and use your personal protective equipment, as we call PPE, which people are going to see all over the news. PPE, it's your gloves, gown, mask. So I think different regulations at different places.
Yeah, and pregnant women are, the regulations and the recommendations in terms of prenatal visits, which we can also talk about later. I'll talk about it with you guys because this is more about COVID-19 and babies, but we're getting a lot of questions about pregnant women. This is a touchy subject. What about all that extra screen time that toddlers are getting? Should we be concerned about that? Always, it's a convenient babysitter, but now when we're all home and we're trying to work from home, is it a necessary evil? Or even, should we relax our standards a bit about TV?
I think we have to relax them, because if you have to work at home and you don't have another person there who can help you with the child, then you can't feel guilty. You're doing your very best. And you know what? You're going to have quality time when you're done with your commitments that you have to do. Then you will go outside with them, and then you will have floor time and play time and puzzle art time, cooking time. And we do want families to have sort of a routine and to have a schedule. It's often good to have it posted or written up with times, because knowing your schedule and managing the expectations of the day are important for everybody.
Yes.
So if they end up watching 2 movies because you have important meetings, then so be it. It's not going to rot their brain. It's just not. And then, I have to say, growing up when I did and people didn't know screen time was bad, I think I saw my fair share on certain days. You know what I mean? So I think that it's all in moderation, and it's all based on what's happening right now. And if you can balance it with the rest of the time we're doing books and puzzles, or watch something with them and talk about it, make sure it's more educational. So you're looking at more public broadcasting type stuff and, learning, educational, Sesame Street and good things. So at least they can get some good out of it.
Exactly.
Yeah.
So no guilt, lose the guilt. The last symptom we need from COVID-19 is extra guilt for moms. We want to, and dads, let's just leave. And the other thing is there is a silver lining to having to stay home. And I know a lot of people don't have the luxury because they're essential workers. But if you have the time to stay home with your little ones, as stressful as it can be sometimes, the silver lining is that you're spending more time with your kids and they love that. But what if they pick up your stress signals? A lot of babies don't sleep as well, or there are temper tantrums in toddlers just because everyone in the house is so stressed. Are you seeing that a lot?
Well, we've definitely had questions about it, and the Academy of Pediatrics is really trying to encourage families to kind of think ahead for their day. So, and plan, how can we relieve the stress? And again, I think having a routine and a schedule can help. It can help. If you're starting to feel really stressed, you may need your own time out. So but you know what? You're going to make a mistake. You're going to lash out and go, why did I yell at her? Why did I yell at him and feel bad about it? That happens to every parent anyway.
You're a human. By definition, if you are a human parent, you are a human.
Right. And you know what? You get a do-over every day. You just start fresh. And so you can use that and plan ahead and go, next time they do that, I'm going to take my big breath and I'm going to try my usual methods of distraction and changing the subject. And let's go do this instead. And really try. But if you take care of yourself and you can get some sleep and your own little bit of me time, even if you can take a walk for 20 minutes, something that's going to help you handle everything better. If you give yourself Do a face mask, have some kind of something for you, you know?
Or FaceTime.
FaceTime is always good. Yeah.
Face mask, FaceTime, same
Face
thing.
mask, FaceTime, whatever your thing is that you can relax, or just know, okay, when they go to bed, I'm not going to work. I'm going to take 30 minutes and watch something fun or funny or a comedy special or something that takes my mind off stuff. Just a recharge thing.
And I also think that sticking as much as possible to routines at home for babies is really helpful. It's more stressful now, yes, but babies crave routines, toddlers crave routines. And in the face of change, nothing is more comforting, right? Things are changing a lot around you. Nothing comforts toddlers and babies more than consistency and routine. So that's important to keep in mind too. You know, something that moms are worried about a lot if they're pregnant and they're due to deliver soon is, you know, is it safe to deliver in a hospital? You're in the hospital every day seeing newborns. Is it safe to deliver in a hospital? And are moms getting discharged sooner than they used to be, or than they are standard during normal times?
Right. I mean, those are great questions. Right now, we still believe it is safe as it ever was, because there's other things you think about when you think of safety. So safety from the infection, everyone's being extra careful. They're taking temperatures. There, even a lot of hospitals are testing for COVID-19 when moms arrive to deliver. They're actually testing people. So that, I think, will be implemented more. But still, in case of an emergency, hospitals and healthcare workers are already so stressed. If you have a complication and at a home birth, it might be trickier to get someone to help you. And maybe those EMS workers or whoever comes, they're exposed to so many people. There are a lot of firemen here in LA now testing positive.
That's what I'm worried about.
And I worry about that as other strangers coming into your home. I think in a healthcare facility, they're so used to being more sterile anyway. I still think it's okay. As far as postpartum discharges, I did talk to one OBGYN friend of mine yesterday about it. And in general, the hospital is saying, yes, if they are well and they can be discharged, probably better to, you know, if you're healthy and recovering fine, probably good to just go home and go back to your isolation at home, you know, and your social.
Yeah, that's great. So, Dr. Crosby, I am so grateful that you could spend this time at home with me and at home with all the moms. And we're going to come back to you for sure for some more advice, because we love having you on.
Thank you so much for having me. It was so much fun. I would love to do it again.
Okay.
Okay.
Big hugs.
Bye.
Bye.
Bye.